Double mastectomies will not improve survival odds for patients battling cancer in just one breast. Researchers found the survival rates nearly identical to those who have less invasive procedures. But the number of women getting the surgery jumped 29% over 13 years. Some point to celebrities like Angelina Jolie, but she had the BRCA gene, which greatly increases the risk of breast cancer.
I'm a little bit surprised at the amount of people that actually want bilateral mastectomies, but I'm not surprised in the sense that I think we all fall prey to what we hear on the news, and we admire celebrities and we kind of use them sometimes as a model.
Doctors say only 5% of all breast cancer patients have that mutated gene, but they say women should get tested if there's a family history of breast or ovarian cancer.
Women may be getting too aggressive a treatment for breast cancer.
Fox 4's Latoya Silman's here with the details.
Well, Lauren and Tim, double mastectomies are on the rise, and one study calls it an Angelina effect. The actress Angelina Jolie had the procedure done last year. She has a very rare genetic mutation that makes it more likely for her to get the cancer. It's called the BRCA gene, and fewer than 5% of breast cancer patients actually have it. A JAMA study found that in 1998, only 3.6% of women with breast cancer opted to remove both of their breasts. In 2011, the number rose to 33%. And just a few years later, Angelina Jolie's double mastectomy really got people's attention. Oncologist Gerald Edelman says a double mastectomy is a mistake for most women.
She's not going to have a better outcome. So doctors that treat breast cancer like to recommend to patients that they get conservative surgery with radiation therapy and any additional therapy like such as hormonal therapy or chemotherapy for that cancer, but we don't want to over-treat patients.
Dr. Edelman says that he wants patients to make decisions based on science. The BRCA gene is inherited. If there's a family history of breast cancer or ovarian cancer, Dr. Edelman says that women in their 20s should get checked for the BRCA gene. Now, it's a simple swab test that's done in your mouth. And later in the newscast, you'll hear from a woman with breast cancer who opted to remove only one of her breasts the first time she had cancer. And even though it's back, she says she has no regrets. She'll explain why. For Good Day, I'm Latoya Silman.
Getting a double mastectomy may not be the best way for women to fight breast cancer. We're going to look at some new research coming up.
25 minutes after 8 o'clock, a very aggressive treatment, double mastectomy, may not save any more lives than a more conservative approach for women with breast cancer.
Latoya is here to explain.
Well, Lauren and Tim, 3 recently released studies give women a lot to think about. One study found the number of women getting double mastectomies is up. The second one found that women who choose to do so survive about as long as patients who choose less invasive measures. And a third study blamed the popularity of the aggressive procedure on Angelina Jolie. They actually called it the Jolie effect. Last year, Angelina Jolie's double mastectomy really got people's attention, but one North Texas doctor says it should only be considered for women who carry the BRCA gene, a rare genetic mutation that increases the chance of breast and ovarian cancers. Jolie carries the gene, and fewer than 5% of breast cancer patients actually do. Dr. Gerald Edelman says that less invasive procedures are likely the best option for those who don't carry the gene.
I want people to actually make decisions that are based on science and rational, and not just making decisions based on what they think is popular or mistaken notions.
A simple swab test done in your mouth can determine if you carry the BRCA gene. The best way to determine if you should get tested for it is actually your family history. So if there is a family history of breast cancer or ovarian cancer for that matter, Dr. Edelman says that women in their 20s should definitely get tested. For Good Day, I'm Latoya.
Hey, welcome back. 23 minutes after 7 o'clock, a double mastectomy, pretty radical surgery, may not save many lives, but many women are demanding them to treat breast cancer.
A new study finds a more conservative approach really may work. Latoya is here with more.
Well, Lauren and Tim, double mastectomies have gained popularity, especially since some celebrities have done it, but doctors say it only really helps you if you carry the BRCA gene. Actress Angelina Jolie has that bad gene, and in 2013, she announced her diagnosis and removed both of her breasts. North Texas oncologist Gerald Edelman says that she did the right thing, but fewer than 5% of women with breast cancer actually have the bad gene. For them, a double mastectomy wouldn't improve the chances of staying cancer-free, according to a new study. Now, one breast cancer patient says the surgery is very invasive. In 2009, she opted to remove one of her breasts.
It felt like I had a brick sitting on my chest for the whole 7 months of the ordeal, and no, I wouldn't have wanted it on both sides. That would have been horrible to have dealt with it if I wouldn't have had to. So I'm glad I didn't do both. I mean, God gave me a clean one, and I'm keeping it.
Teresa Best does not have the BRCA gene. Her cancer is back, though, but it's not in the other breast. It has spread to other parts of her body. So she says that if she would have gotten a double mastectomy, she would still be in the same position she is today. So here's the question. How do you know if you have BRCA or not? Well, all it takes is a swabbing test of your mouth, and women with a family history of breast and ovarian cancer should get the test in their 20s. For Good Day, I'm Latoya Silman.